Plavix has gained over 20 years of clinical evidence and experience in secondary stroke prevention, with over 55,000 patients in 8 large randomized controlled trials and over 200 million patients treated worldwide, including TIA and stroke. Plavix is approved in combination with ASA in adult patients with moderate to high-risk TIA or minor ischemic stroke within 24 hours of either the TIA or ischemic stroke event. At hospital admission, these patients reflect the majority of patients presenting with cerebrovascular symptoms, with 70% of TIA patients and 50% of stroke patients. These patients are at an increased risk of early stroke recurrence. In fact, a large registry showed that about 30% of all recurrent strokes within the first year after such an event occurred within the first 2 days. Moreover, early stroke recurrence has been associated with a 32-fold higher risk of in-hospital mortality rate. Therefore, American and European stroke guidelines call to reduce the risk of recurrent stroke with early disease management. Both give their highest recommendation to the early use of Clopidogrel plus ASA, initiated within 24 hours and continued for 21 days. Based on the high-quality evidence from the large pivotal trials, CHANCE and POINT, the pooled trial data demonstrated that this treatment strategy significantly reduced major ischemic events by 34% compared to ASA monotherapy, while showing comparable rates of major hemorrhagic events. After the initial 21 days of Clopidogrel plus ASA, both guidelines recommended continuing with antiplatelet monotherapy for continued secondary protection. A meta-analysis with 30,000 recent stroke patients demonstrated that Clopidogrel significantly reduced the long-term risk of MACE by 23% and the risk of hemorrhage by 43% compared to ASA monotherapy. These results support the clinical benefit of long-term use of Plavix over ASA in patients with recent ischemic stroke. Plavix, at the center of guideline-recommended antiplatelet treatment strategies for moderate to high-risk TIA and minor ischemic stroke patients' pathway from early initiation to long-term control for continued protection.